Hi, I'm Dr. Marcia Sirota, and today I want to talk about the mental health implications of the recent overturning by the Supreme Court of the United States of Roe v. Wade. And before I start, I thought it would be important to explain what exactly is Roe v. Wade. So I'm going to take my little piece of paper, and this is what Roe v. Wade was, according to Wikipedia. Roe v. Wade was a landmark decision of the United States Supreme Court in which the court ruled that the Constitution of the United States generally protects the liberty to choose to have an abortion. And this decision, which was made in 1973, struck down many federal and state abortion laws and fueled an ongoing debate in the United States about whether or to what extent abortion should be legal and who should decide the legality of abortion and what the role of moral and religious views in the political sphere should be. So that's what Roe versus Wade was. And just the other day, the Supreme Court in the United States voted it down in a 6-3 decision. And what that means is that now there is no constitutional legality to get an abortion. And I was wondering, what that would mean for women in the United States in terms of their mental health, because this was a big decision. And I have spoken to some women, and these are the kinds of things that I'm hearing. Young women have become very distressed by this decision because it makes them feel like their freedom to choose has been taken away. And racialized women and women who live with poverty are distressed because they are generally the ones who suffer the most when abortion laws are more restrictive. Young women are looking for their future, and seeing a future where they have less bodily autonomy makes them more anxious and depressed. And racialized and poor women look toward their future with these kinds of restrictions, and they feel like their freedom is being curtailed even more and their opportunities are being curtailed even more. I was reading in the Harvard Kennedy School faculty discussion about Roe versus Wade being overturned, and this is what some of the faculty was saying. It is important not to underestimate the degree to which restrictions on reproductive health care obstructs equal access to political participation for women. Pregnancy and early childhood parenting significantly reduces voting and other forms of political participation. Women with unintended pregnancies and births are at much greater risk of depression, which is also associated with a significant decline in voting participation and sense of self-efficacy. And women who are unable to safely access abortion may die or become severely injured from medical complications or from intimate partner violence. The potential harm to people who are most adversely affected by these policies and their reduced ability to participate in civic action is an important reality that our society will need to address. And so this article agrees with me in a sense that the women who are most vulnerable are the ones who are most likely to be depressed due to this overturning of Roe versus Wade. Now, as well, the Harvard Kennedy School discusses how these women also have less access to political participation and paradoxically have less of a voice therefore. There's this kind of synergy where when we are restricted in one way, we become restricted in many other ways. And one of the ways we are affected is in terms of our mental health, because when the government is taking away some of our basic freedoms and rights, we feel more anxious, more depressed, and more overwhelmed. And even those women in Canada who I discussed this with are feeling this as well. And they're worrying that Canada might follow suit and start to restrict our own rights to bodily autonomy. Now, I personally feel that there should be a separation of church and state. I think this is something that is very important so that if you are a religious person, your religious beliefs have nothing to do with whatever government is in place in the moment. I really do feel that religion should be separate from politics. But these days, it seems like they're becoming more enmeshed, and there are a lot of people who are going to be adversely affected by this, especially women who are younger, women who are racialized, and women who live in poverty. So Roe versus Wade being overturned, aside from being a very momentous political decision, is also a decision that is going to have quite a significant impact, I believe, on the mental health of women across the United States and even in Canada. And, this is a very difficult time. We've just come through a pandemic. We are facing mounting rates of inflation, and we could not be any more stressed than we already are. And then Roe versus Wade is overturned, and there's another thing that is burdening us. And so I want to just add a little tip at the end of this conversation, just to help those people who are watching this video. I think it's really important, because we've been under so much stress lately, to notice signs that you're not doing well. So some of the things that you should pay attention to are you getting enough sleep? Are you waking up in the night, or are you having difficulty falling asleep? Is your mind racing at bedtime? Are you worrying, staying up till all hours of the night, stressing out and worrying about things? That's a sign that you're not doing well. Have your eating habits changed? Are you eating more or less? Or are you eating at odd hours? Another thing to look at is, are you irritable, more impatient, or more intolerant? These are all signs that you might not be coping well, and that you might be having anxiety or depression, or even both. Another sign is, are you engaging in any type of addictive behavior? Are you drinking more? Are you taking to drugs, self-medicating with food? Are you gambling? Are you shopping to excess? Are you spending too much time online? Any of these things can be signs that you're not doing well with your mental state. So mental health has a lot of signs and signals, so that if you're having difficulties, you can notice them by looking at these signs and signals, like your sleep, like your appetite, like whether or not you're having addictive behaviors. Other signs and signals can be, are you having energy changes? Are you more frantic, more agitated? Are you more exhausted, more unmotivated? These are also signs that you might be having difficulties. And if you're having interpersonal conflicts, that could be another sign that you're struggling with your mental health. So if any of these things, or some of these things, are happening to you, it would be a really good idea for you to notice that you're having mental health difficulties and to get the help that you need. And there are all different types of help available. There are self-help books and videos. There are online group therapy sessions available. There are in-person therapists. And certainly there are medications that you could take if you're really having difficulties. So whatever it is that you're struggling with, you deserve help, and there's certainly no shame in asking for help. The first thing you can do is just talk to a friend or a family member and see whether that's enough to help you feel better. And if that's not enough, then maybe it's time to talk to a professional. And if that's not enough, it might be a good idea to consider other forms of treatment. I'm Dr. Marcia Sirota, talking about the mental health implications of the overturning of Roe versus Wade. Stay tuned for more content. I'll speak to you soon.